Hi, my name's Kim Weller. I'm the Director of Outpatient Rehab, and I'm here today to talk to you about MedBridgePathways.
The Pathways program has a curated list of exercises developed by clinical experts, orthopedic surgeons, physical therapists that are associated with MedBridge, and also using clinical practice guidelines as a backbone for what's being developed. There is no charge for MedBridge Pathways. It is a free app. It is a free service for them.
Pathways is really nice because the first phase of almost all the programs is basic. It's isometrics, active range of motion, things that are going to get blood flowing, get them moving, but for most patients is not going to aggravate them. So I think it builds confidence and gets them started on a program where they're used to this habit of doing something at home.
About 80 to 85% of what I would have chosen is in the pathways, or it's in the progression. Each week gets a little bit more challenging. Each week gets a little bit more difficult.
And what we noticed is it was effective for many patients.
It works very, very well with patients that are kind of in acute stages of injury or flare-up, where patients wouldn't need a lot of follow-up or hands-on assistance.
The first 3 pathways that I passed out were for patients that were going to Florida for the winter, or they had cost constraints where they couldn't make it to therapy more than 1 to 2 visits.
There are patients that I'm prescribing pathways and then sending them into the clinic at a certain point if they need something hands-on that I'm not able to provide them.
Patients are really responsive to it, very engaged by it. They've been very pleased, they've been very happy. A number of times I've heard people say, man, this is exactly what I'm looking for.
Then when they get into the clinic, they've already been working on something, they know what PT entails, they know how much work they're gonna have to put into it at home, and you can progress this for them.
The last 5 years, 6 years, we've transitioned from the mindset where we have to see patients in the clinic 2 to 3 times a week. We have since transitioned down to maybe we're gonna see them once a week, maybe we're gonna see them twice a week.
I can use that session I'm seeing them for hands-on techniques, manual therapy, neuromuscular re-education, tactile cueing, things that can't be done at home. And I don't have to take that clinic time to progress their program.
The educational content that comes within Pathways saves me as a clinician from going through and explaining pain theory and pain science. All that information is contained within Pathways.
That's something that it takes off of my plate so that I can spend more time in the clinic doing skilled work that they can't do on their own.
I would really like you to take the time to familiarize yourself with Pathways and become comfortable with using them. Recognize that there is great benefit to your patients and to yourself. I'm asking for a mindset shift for you to be open and to think Pathways first.